Came across a story. I guess this was an op-ed in the Gazette earlier in the week. Maybe something that we have never talked about, maybe because we didn't know, but it's interesting that it's being raised now. And again, it's one of those things you kind of question yourself in the healthcare system of Quebec, how this is not part of what's covered. I'm referring, in this particular case, to a publicly funded cervical cancer screening program. My understanding being that, as I said, Quebec is the only province in Canada that does not do this. Now, we're going to talk about this with a couple of women over at McGill who are talking about this. But first, this did make it, by the way, to Quebec City, to the National Assembly, where Christian Dubé, the health minister, reacted. Here's what he said.
I think that we have improved a lot on those services, but maybe not at the level that we should have, but I think we have some limitation, but we are looking at that right now.
So there's a looking at it. I'm not quite sure what limitations he's referring to. Let's try to find out a bit more. Halle McNamarra is a second-year Master of Science student in public health at McGill, along with Fiona Kavcic, who's on the line as well. Ladies, thank you both for being here. Whichever one, let me start with your reaction to what you heard the minister say. Does that sound promising to you?
Hi. It does sound promising, I guess, but I think considering looking at sort of the plan that has been in place since 2022, where they wanted to move from Pap tests to HPV tests, and we haven't seen that progress from 2025, I'm a little hesitant to necessarily see too much promise with that, but it's good that they're at least acknowledging it.
Can one of you explain, whatever you can identify yourself, just what kind of cervical cancer screening are we talking about, and what is currently offered here now?
All right, so I'm Halle, and in terms of what's currently offered in Quebec in a publicly funded capacity, they're currently, as I mentioned, in the province in the process of transitioning their primary cervical cancer screening method, and it's being implemented gradually across different regions between as I mentioned, between 2023 and 2025. So the type of screening test that you can get does depend on the region that you live in Quebec. And the Pap test is recommended every 2 to 3 years, and the HPV test is recommended every 5 years to eligible individuals who are between 25 and 65 years old, have a cervix, so regardless of gender identity, have been sexually active, and are insured by the Quebec Public Health Insurance Plan. And although these procedures are covered by RAMQ, without a centralized provincial screening program, individuals have to consult a healthcare provider in order to actually access these services, which can obviously present a major barrier to screening.
Okay, so you'd have to access this on your own in order to sort of get the ball rolling, if you will, here. How does this differ from other provinces across the country?
Yeah, so I'm Fiona. So other provinces across the country have different types of screening programs. So, for example, in British Columbia, they run a publicly funded HPV testing program. And so what this looks like is that individuals who are eligible can go online to their website and sign up and put their address in. They can get a self-sampling kit sent directly to their house, do the self-sample, it's a swab, and return this into different laboratory centers across the province. So this is one that's a more self-sample and is more accessible for people who don't have a healthcare provider and also in more remote regions. Other areas, such as Ontario, is still using a Pap smear-based program, and this is different in the sense of Quebec that you don't actually need to consult a healthcare provider, so you don't have to have a primary care provider to be referred. This can be just offered in public health clinics.
Okay, so I'm guessing that's what obviously you would like to see here, either one of those two, I guess, systems. Although it seems to me sending this in on your own might even be the simplest way to do it, right? And get results back that way.
Yeah, I think that it does address a lot of limitations in the sense of, obviously, if we are implementing a screening program, we're going to have the infrastructure in place in order to be able to accommodate the increased screening, potentially new diagnoses and follow-up care. With self-sampling, I think it's a really innovative approach. I think there are a lot of also barriers to people accessing healthcare services for multiple different reasons. They might not feel comfortable having these procedures done or to actually go into an office and have this completed. So self-sample can make this a more comfortable experience for some individuals. Also, with the landscape of Quebec, this also is a really unique option, so we can help improve coverage of these screenings in the northern regions as well.
So when you hear the minister refer to, great, interesting idea, refer to limitations, what do you take limitations to mean in that sense?
So this is a really good question. We had some difficulty actually finding information on specifically why Quebec hasn't implemented a screening program. And according to the 2011 screening guidelines from the National Institute of Public Health of Quebec, they do list some limitations of cervical cancer screening programs. And so they say that these can fall short of their goals due to low participation among certain groups of women, the limited sensitivity of Pap tests, so if the test can actually detect the precancerous lesions of cervical cancer, and then also inadequate follow-up care for those with abnormal results. However, I will note that the guidelines then move to discuss that opportunistic screening, which is what is currently done in Quebec, is less effective than organized screening. So given this, the continued absence of a screening program initiative is kind of difficult to justify, and although there are limitations with a screening program, it is not super clear to us, and it does raise questions about the underlying rationale for that.
I wonder, too, was part of the motivation here in bringing this or making the public aware the fact that we are seeing an increase in cervical cancer cases?
Yeah, I think that's kind of one of the main concerns because as we know, like for the first time in over 30 years, Canada is now experiencing a yearly increase in its new cervical cancer cases, and I think it goes to also note that like early detection is obviously crucial because the 5-year survival rate for cervical cancer is 91% when diagnosed early, which is obviously very high, but it drops down to just 19% once the cancer has spread. And I think given the fact that effective screening measures exist and are available to be able to detect the cancer this early, when obviously survival rates are highest, there's no real justification for women living in a province with established public health infrastructure to face these lower survival outcomes.
When if you're confronted with a situation where you want to go get tested, what do you do as a woman in a case like this? What's the process now?
In terms of functioning in the Quebec context, if an individual is eligible, so the criteria that Halle had listed earlier, you're at the correct age range, you have a cervix, you've been sexually active, and you have your MQ, you go through a consultation process with a healthcare provider. So if you are fortunate enough to have a primary care physician, they can refer you to have the service done at an OBGYN or a gynecologist. We did mention and provide some examples of clinics that in our op-ed that do not require a referral. So this is something that has been kind of in the last few years we've seen an increase in that there are clinics that are being created, women's health clinics, where individuals don't have to have a referral from a primary care provider to go and get their Pap test done. So there are a few different options for individuals to access screening in this sense. And we also did see at the Jewish General Hospital last year, they had a free day, a clinic day where Pap smears was free for all individuals. They just needed to come with their REMQ, and they didn't need a provider. Mm-hmm. So it's kind of a mix of public initiatives that are available in the region as well as those who have a primary care provider.
Seemed like it would, I don't know, just I was thinking as you said that it might not be a bad idea to have a public awareness campaign of some sort just to let people know what the situation now is to begin with. Do you think that makes sense? And the other part of my question would be, has anyone on the other side, any government official, now that this is sort of out there, said, look, I want to take this on and I'll sort of be your champion here? Have you heard from anyone?
Not current. We haven't heard from anyone ourselves. But I do think that public awareness is obviously a huge thing. As we mentioned in our op-ed, the mayor, Catherine Fournier of Longueuil, raised awareness about cervical cancer after her friend received a terminal diagnosis. And obviously, I think bringing awareness from people in kind of the public sphere definitely helps. And, she highlighted that obviously dying from cervical cancer is a tragedy, but again, kind of what we've been going back to, this is something that is like entirely preventable with proper screening and early detection.
Well, let's hope someone is paying attention. Obviously, the minister's aware of this, and let's hope we can move forward because it doesn't seem right that we be the only place in the entire country that doesn't take care of this and publicly fund it. Ladies, thank you both very, very much. Appreciate it.
Thank you for having us.
There you go. So a couple ladies who brought this to our attention via an op-ed post or column in the Montreal Gazette.